A client prescribed warfarin has an INR of 6.2. What is the nurse's priority action? A, give the next dose. B, administer vitamin K. C, encourage green leafy vegetables. D, recheck INR in 48 hours. The correct answer is going to be B, and this is because vitamin K is the reversal agent and must be given immediately to reduce the INR and restore clotting ability. The nurse knows the digoxin toxicity is most associated with which finding? A, constipation, B, yellow vision, C, tachycardia, or D, nosebleeds. The correct answer is B, yellow vision. Yellow-green vision halos are a classic sign of digoxin toxicity. A patient taking lisinopril reports a dry cough. The nurse should A, stop the medication and notify provider. B, give cough syrup. C, increase the dose. D, encourage deep breathing. The correct answer is A, stop the medication and notify the provider. The correct answer is going to be B, hypokalemia, and this is because loop diuretics increase urine output and waste potassium, causing muscle cramps, dysrhythmias, and weakness. Before administering metoprolol, the nurse must check A, blood sugar, B, heart rate, C, hemoglobin, or D, urine output. The correct answer is B, heart rate. Beta blockers lower the heart rate and blood pressure, so we want to make sure that we hold the dose if the heart rate is lower than 60 beats per minute to avoid dangerous bradycardia. Which medication requires the nurse to assess for muscle pain due to rhabdomyolysis risk? A, statins, B, ACE inhibitors, C, antacids, D, beta blockers. The correct answer is A, statins, because statins may cause muscle breakdown, rhabdomyolysis, which may lead to kidney failure. Report muscle pain immediately. A patient receiving morphine develops a respiratory rate of 6. What is the antidote? A, protamine sulfate, B, naloxone, C, flumazenil, D, atropine. The correct answer is B, naloxone, and this is because naloxone immediately reverses opioid overdose. A client taking spironolactone should avoid A, bananas, B, apples, C, strawberries, or D, grapes. The correct answer is A, bananas. Spironolactone is potassium sparing, which causes hyperkalemia, so you want to make sure that you avoid high potassium foods. Which medication should be held for a patient with bradycardia? A, atorvastatin, B, levothyroxine, C, metoprolol, D, furosemide. If you answered C, then you are correct. Metoprolol lowers the heart rate hold if the heart rate is less than 60. Which antibiotic requires avoiding sunlight? A, amoxicillin, B, doxycycline, C, ceftriaxone, or D, vancomycin. The correct answer is B, doxycycline. Doxycyclines are a tetracycline which causes intense photosensitivity and poses a high sunburn risk. Which drug must be taken on an empty stomach? Is it A, levothyroxine, B, carvedilol, C, metformin, or D, omeprazole? The correct answer is A, and this is because levothyroxine must be taken in the morning 30 to 60 minutes before food to improve absorption. A patient taking gentamicin needs monitoring for A, hepatotoxicity, B, nephrotoxicity, C, hypoglycemia, or D, rash. The correct answer is B, nephrotoxicity. Aminoglycosides damage kidneys and ears. You must monitor the bun creatinine as well as the urine output. A patient starting nitroglycerin should be taught A, expect hypertension, B, sit down before administration, C, take with food, or D, discontinue for headache. The correct answer is B, because nitroglycerin causes sudden vasodilation, leading to dizziness or severe hypotension, puts the patient at risk of falling. A client with asthma should avoid which medication? A, albuterol, B, prednisone, C, lisinopril, or D, propranolol. The correct answer is D, and this is because non-selective beta blockers cause bronchoconstriction, which can trigger an asthma attack. Which is the therapeutic level for fentanyl? A, 1 to 3, B, 5 to 10, C, 10 to 20, or D, 30 to 50. The correct answer is going to be C, 10 to 20. A patient on heparin has a PTT of 150. What does the nurse do? A, give protamine sulfate. B, administer the next dose. C, increase the infusion. Or D, no action needed. $150 is dangerously high, which poses a bleeding risk. Administer reversal immediately. Which medication can cause C. difficile? A. Amoxicillin. B. Clarithromycin. C. Cephalexin. D. All of the above. The correct answer is D, all the above. Any broad-spectrum antibiotic can disrupt the flora of the gut, which can lead to C. diff infection. Before giving metformin, the nurse should check A, renal function, B, platelets, C, sodium, or D, weight. The correct answer is A, renal function, because metformin is cleared through the kidneys. So impaired renal function increases risk for lactic acidosis. Which finding indicates lithium toxicity? A, polyuria, B, tremors, C, weight loss, or D, muscle strength. The answer is B, tremors. Tremors is one of the signs that indicate lithium toxicity. A patient taking clopidogrel should be assessed for A, hypotension, B, bleeding, C, tachycardia, or D, edema. The correct answer is B, bleeding. Clopidogrel is an antiplatelet drug which increases bleeding risk. We have reached the end of the first round of pharmacology practice questions. Be sure to drop any questions that you may have in the comment section, and definitely check me out on social media for additional LPN school survival tips, study notes, as well as NCLEX prep.